Hey everybody, Tim White, clinical specialist here with Aspen After Surgery Center. We're here with a patient of ours, Megan, today, who's being discharged from our treatment program. Megan decided to shoot this video with us because she has dealt with contracture in the past. She had contracture, she sought out the Aspen treatment for this, and now we're very happy to say she did amazing. Her results have been spectacular, especially considering how advanced her particular contracture was, despite doing very well. So thanks for being here with us.
Yeah, of course.
Awesome. So Megan's experience and her history was that we had two surgeries, two reoccurrences of contracture. So contracture, a surgery to fix a contracture happened again, so let's stop there with that. This is one of the resounding problems, if you will, with this type of condition, and the quandary that the surgeon has is that surgically revising capsular contracture is probably one of the most difficult surgeries to do out there because of its very high reoccurrence rate, and you're a testimony to that, and most of our patients are as well. Surgeons offer lots of techniques, whether it be skin strips that they add in, type of surface of the implant above or below the muscle. Surgeons can prescribe medications and all kinds of other things. But our treatment involves none of that, and we have a very high statistical rate of success, and Megan is a result of that. In regards to, how you grade your experience. So in the beginning, you had over a 2 centimeter differential. In other words, Megan's asymmetry was pretty pronounced, very visible. This is one of the initial signs that our patients see is they say, well, in a bra or bikini, you could really notice the fullness of the top, or in a V-neck or something like that when I'm at the beach, or, my job requires me to wear a certain outfit. You can really see this. That's the number one sign of capsular contracture. If one or both of your breasts are very high and balloony looking, it's a pretty good chance that that's implant contracture. If you had to grade your success with the treatment, Megan, and the overall kind of shape, position, and softness improvement from the beginning to end, what would you say you would give that a score of?
Like scale of 1 to 100, or
Yeah.
like a letter grade?
Yeah.
I would say 90 to 95% improved. Like that would be like an A, like it worked really well. Much better than I anticipated considering how severe it was.
Yeah.
I was really concerned that it wouldn't work at all, but I would say it's almost 100%. Like you would not be able to tell.
Perfect. Megan's treatment course was, you had 10 total treatments. Her responsibility was certain home program exercises and massage. She, of course, received the treatment here. Let's talk about some of the history regarding your issue. Now, you've had 2 issues with contracture, but one of the other notable things was you had puckering in I believe your first procedure, correct? In which the incision line along the areola had actually puckered. This is something that we also emphasize patients do a self-examination, where if you look in the mirror and you see one implant or both implants high, they're firm, but if you have that classic dimple or incision, that is a secondary sign of capsular contracture. What happens is that capsule that's located around the implant begins to tighten. It'll actually tether that incision and it'll start to pull that up. So if you see that sign, that may be another indication of capsular contracture. Give us a call. We can normally screen these things over the phone or by email and help you identify, hey, this is a capsule, and are you appropriate for non-surgical treatment. You've done great. We're discharging you today. Megan is done. She doesn't have to do any more massages. There's nothing else she needs to do. Her results should maintain. Most of the patients that receive our treatment maintain their result for life. We also educate patients on things to not do, to not get contracture again, so you have all that as well. If patients in general had a kind of an overall SMA, what do you think about the treatment? Did it work? Do you recommend it for other women? What would you say?
I would say that it was way more cost effective, way more recovery time. Like effective than if I had had surgery again. When I got capsular contracture the second time around, I was pretty devastated, thinking I was going to have yet another revision surgery, which in my experience was much more painful than the initial augmentation. The recovery was more difficult. And it's just, it's not ideal. You don't want to have surgery. No one likes being cut open. It's not fun at all. It's really painful and hard. And this is so much cheaper than that. It's so much easier than that. Realistically, is it, a time commitment in terms of the at-home stuff? Sure. But I would way rather be at home, wearing a wrap and doing some massages than I would be, laying in bed immobile because I can't lift my arms or wash my own hair. Like, it's just much more ideal in terms of treating this. If you're a candidate for it, I would say absolutely give it a try. What's the harm in trying something new?
Good feedback. There's no risk associated with this treatment. There's no downtime. You can exercise, you can work, you can eat what you want, you can do whatever you want. There's no limitations, there's no restrictions. The cost, of course, is a fraction of what patients would pay for surgery. Big notes is that even when surgeons give discounts or provide you with some sort of incentive to go with surgery, you still are at the risk for re-encapsulating. So, the things we tell our patients is even if your surgeon offers you the surgery for free, statistically you're going to re-encapsulate again anyway. So why not put your time, energy, and money into something that is statistically proven to work, painless, non-surgical, way more effective than surgery is, to be able to not have to go for surgery and not have that downtime. Awesome. Well, Megan, thank you very much. Congrats on your great results.
Thank you. Thank you for your help.
Our pleasure. Anybody who wants any information, give us a call on our main line, 1-877-277-3615. Go ahead and check out our social media, and don't be afraid to subscribe to our YouTube page.